Houston Methodist Hospital Sugar Land continued its series of educational seminars with a very well-attended lecture on joint pain by sports medicine specialist Dr. Timothy Sitter.
We talked about joint pain and a variety of ailments that can cause joint pain, and treatments from anywhere from non-surgical treatments including pills and injections and therapy and braces, supplements, as well as the more invasive procedures such as partial and full knee replacements, as well as some of the controversial topics such as stem cells and amniotic fluid injections. What happens is the cartilage is like the tread on your tires, and it has a finite lifespan. And you only get one set to last your entire life. And after the age of 30 or 35, the cartilages start to dry and split and crack. And they can't heal because they don't have a blood supply. So like the paint peeling on your house, it starts coming apart. When it does, it causes inflammation, locking, and all those symptoms that people get. That's what arthritis is. It's the wearing out of the joint.
The surprising and troubling news to most people is that cartilage, unlike most parts of the body, cannot heal itself.
It can't reproduce. In fact, cartilage is about, if you took 1 cubic centimeter of cartilage, it's 10% cells and 90% bits and pieces of protein. And because there are no blood vessels to it, once it's formed, it sits there and it gets its nutrition from the surrounding fluid. And as that changes as we get older, that's why the cartilage starts to dry, crack, break down, and deteriorate. The things that we normally tell people to do initially when they have an attack, you don't need to run and spend a large copay to go see a physician. Ice 20 minutes 5 times a day is a good start. Avoid heat. There is a place for heat, but you can go wrong with heat, so we usually tell people to stay away from it unless you've talked to a professional about using heat. The over-the-counter medications that you hear about, including naproxen sodium, which is Aleve, and ibuprofen, which is Advil or Tylenol. Rest for a day or two, and then immediately start to move the joint and be a little more active. If it continues to flare over about 5 to 7 days and it doesn't go away, then maybe it needs to be looked at.
Another question Dr. Sitter is used to answering concerns diet and joint pain, especially the popular gluten-free diet.
The gluten-free diet gained in popularity. We've always been looking for a magic diet. There's hundreds and hundreds of diets out there, and the gluten-free came about with a push from the modified food groups and things where we started genetically modifying corn and all that sort of thing, and that they felt that maybe gluten was responsible for everybody's inflammation, achiness, and soreness. That's simply not the case. But it grabbed hold. Everybody was looking for the magic bullet. Nobody wants to get needles stuck in them. Nobody wants to take a bunch of pills. So they thought if I could alter my diet, that might help. Well, what we found was when you go gluten-free, you eliminate a lot of the processed foods which have been throughout history implicated in inflammation and disease and everything from cancers to strokes to all kinds of other maladies, including psychological disorders. So when you go to a gluten-free diet, essentially what you do is you're going to unprocessed foods. Well, if you look at it, that's just eating healthier. You're eating vegetables, you're eating the fruits, you're eating all the stuff that you would buy in the grocer in the market, where you have the lettuce and the tomatoes and all these kinds of things, because they don't have gluten. You're getting away from the starches and the breads and all the saltier foods, the chips, the crackers, et cetera, et cetera. So that's probably why a gluten-free diet works, because people feel better because they're eating healthier and eating what they're supposed to be eating and not a bunch of junk. We've talked about the weight loss, we've talked about exercise, and if you can't do those things and your quality of life has gotten to a point where you're not going to the store, you're not taking trips, you're not spending time with your children, you really need to see a doctor and not let the arthritis grab hold of you and ruin your life.
For more information about upcoming events, go online to houstonmethodist.org. For Healthwise, this is Randall Williams.